controversial opioid alternative.
Popular herbal substance.
$1 billion industry in this country.
Associated with seizures, coma, and death.
Collapses, has a seizure, and dies. Blamed the toxic effects of metrageny, typically marketed as Kratom.
But it's blamed for addiction, seizures, and even deaths.
Unregulated new dietary ingredient.
The issue is Kratom itself.
It's called Kratom.
The dangers of Kratom.
Called Kratom.
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 It's called Kratom.
Dangers of Kratom.
It's perfectly legal in Tennessee.
Kratom, also known as Mitragyna speciosa, is native to Southeast Asia and is indigenous to Cambodia, Thailand, Indonesia, Malaysia, Myanmar, and Papua New Guinea. Kratom has been used as an herbal medicine since the 19th century in Malaysia and Thailand, where the leaves of the Mitragyna speciosa trees are shed and collected to be chewed fresh, smoked, or made into an extract. These leaves have traditionally been used to treat intestinal infections, muscle pain, coughing, and diarrhea, as well as utilizing its opium-like effects for enhancing tolerance for hard work in the heat. Even in the 19th century, Kratom has been reported to be used for the treatment of opium addiction. Kratom has, however, shifted in recent years from its more traditional folk remedy label to an opioid accomplice, branding it with a potential for abuse, spreading beyond the traditional geographical boundaries.
The pharmacokinetics of kratom have only recently begun being studied in humans. In a study, kratom tea was drank by 6 adult participants to try to understand how the substance is broken down in the body. There were pronounced pharmacokinetic differences between alkaloids with a 3S configuration and alkaloids with a 3R configuration. The 3S alkaloids had a shorter median time to maximum concentration, lower area under the plasma concentration time curve, longer terminal half-life, and higher apparent volume of distribution during the terminal phase compared to the 3R alkaloids. The explanation for these differences was suggested to be differential hepatic and intestinal metabolism, plasma protein binding, blood to plasma partitioning, and distribution coefficients.
Kratom contains many different phytochemicals, or plant-based bioactive compounds, with the main psychoactive component found in the leaves being metragenine. Metragenine is the alkaloid responsible for the pain-relieving effects of kratom due to its potent opioid agonist properties. Similar to morphine, studies have shown that metragenine can act as an agonist on the mu, kappa, and delta opioid receptors. These receptors are responsible for its pain-relieving and euphoric effects, though findings show that it remains structurally different from morphine. Also present in much lower quantities in kratom, however, is hydroxymetragenine, which research shows its role as a major contributor to the pain-relieving effects of kratom. Hydroxymetragenine seems to show greater selectivity for the mu and kappa opioid receptors and, when isolated, demonstrates a greater potency than metragenine, with it being 13 times more potent than morphine and 46 times more potent than metragenine.
Although kratom's popularity has increased recently in Western countries, it has been popular since the early 20th century in Southeast Asia. It's the most common illicit drug in Thailand, where about 2.3% of the population have reported lifetime use. In Southeast Asia, a majority of those using kratom are men in their 30s. Kratom use is prevalent among day laborers using kratom as a mild stimulant or as a self-medication. In the United States, estimates of kratom use are still scarce. It's thought that between 0.9 and 1.5% of the American population has used kratom. Those using kratom often are middle-aged, middle-income women using kratom as a type of self-medication. In this way, most of those using kratom do not seem to be using it recreationally.
Advocates suggest that kratom use has multiple benefits, the largest of which being its success as an opioid replacement. Kratom contains active compounds like alkaloids that interact with opioid receptors in the brain. These interactions can aid in opioid withdrawal by reducing physical symptoms like muscle aches and gastrointestinal distress, reducing opioid cravings, and reducing depression, anxiety, and irritability. It's important to note that 47% of individuals with opioid use disorder have been diagnosed with depression at some point in their life and are more likely to have chronic pain. Kratom being readily available for purchase in many states makes it more accessible than current options for opioid replacement treatment and allows for home administration, enhancing the user's sense of control, self-efficacy, and autonomy.
Only about 1 in 5 individuals report adverse effects associated with kratom. The most frequently cited adverse effects include agitation, tachycardia, drowsiness, nausea, and confusion. In addition, a minority of people report dependence on kratom. A minority reports experiences of withdrawal, although withdrawal has not been reported as being severe. Withdrawal symptoms may also include feelings of agitation, gastrointestinal issues, and a runny nose. All these effects are relatively minor. There have been some reported instances of kratom-related seizures, coma, and death. However, these occurrences are few, and a large majority of these reports occur alongside the simultaneous use of other substances. Overall, the reported adverse effects of kratom have been mild. Kratom's greatest harms may come from its reactivity to other substances and contaminants. For this reason, there is a need for more research.
People are buying kratom in the forms of capsules, powders, or extracts through places like the internet, smoke shops, and even gas stations. With this increase in accessibility, it's important for healthcare providers to become familiar with discussing kratom. First, healthcare providers should state that they can't recommend kratom use because it's not FDA approved. However, they can still provide education and non-judgmentally try to understand the purpose of the patient using kratom. Providers should also be aware of the effects of different doses. For example, low doses may have similar effects to caffeine, while higher doses may be needed for successful opioid substitution. When talking to a patient using kratom for opioid substitution, it's important for providers to be aware that these higher doses may make side effects more likely. Also, providers should make sure that they advise patients to only purchase kratom from trusted vendors.